This video is for low back pain, general overview. Important facts of low back pain. No definite etiology is found in about 85% of the cases. 90% of all patients with a single episode of low back pain return to work within 6 weeks. Most patients get better with time. In fact, about 60% of the patient will get better in about 10 days. Low back pain is the second most common cause why the people take time off work. If a person had a history of low back pain, it will predict he could have an occupational low back pain in the future. Only 4% of the patients will have persistent low back pain more than 6 months duration. The disability is usually closely linked to compensation and litigation. The least amount of pressure on the disc was found when the patient is lying supine. The highest disc pressure was found when the patient is sitting with 20-degree forward leaning and 20-kilogram load in the arm. It is better to keep the weight of the load close to the body. This will reduce the compression forces placed on the lumbar spine. Yoga activities and exercises performed during sitting on the floor probably have less pressure placed on the disc. Physical factors which lead to low back pain include lack of fitness, heavy lifting of objects, keep the load close to the body, operating motor vehicles, prolonged sitting, operating vibrating tools, cigarette smoking. Nicotine causes disc degeneration. It affects the nutrition of the disc. Examples of sports-related activities related to low back pain. Golfing. The pain occurs because of twisting, bad forward bending, and most importantly, overarching the spine during the swing. After the age of 40, we lose about 50% of the rotation of the spine. It is important to perform warm-ups and stretching before starting the game. Horseback riding. Vibration caused by horseback riding increases the load on the discs. The back muscles work very hard to keep the posture straight. Caring for the horses also can be bad for the back due to bending, lifting, pushing, and pulling. Virtually any structure in the spine can hurt. The facet joints, the discs, the spinal canal, the sacroiliac joints, the muscles, the ligament the nerves, the hip joint, the piriformis muscle, the trochanteric bursitis. Red flags for cancer. Patient over 50 years, pain at rest and at night, unexplained weight loss, history of cancer, bone destruction involving the pedicle is pathognomonic. Usually the disc is spared and the body is involved. Red flags for infection. Diabetes, fever, drug abuse, urinary tract infection, previous surgery. Usually the vertebral body is spared but the disc is involved. Physical examination, initial assessment. Focus on red flags, fractures, tumor, infection, or coda equina. Try to exclude these red flags first. These are important signs and symptoms of coda equina. Back pain more important than leg pain. Bladder and bowel involvement. Bilateral leg pain and weakness. Saddle anesthesia. In the absence of red flags, imaging studies are usually not very helpful in the first 4 to 6 weeks. Resist intensive workup in the early stages of routine low back pain. Treatment of low back pain. Conservative treatment first. Bed rest, controversial, but it should not exceed more than 2 to 3 days. Pain control by different methods. Watch for toxicity of the non-steroidal. Physiotherapy as soon as the pain is controlled. Soft brace or a corset, it usually doesn't help a lot. Even with the thigh extension, it will restrict only about 50% of the normal gross body motion. It acts on proprioception. It makes the people remember they have a problem in the back. Epidural injection, the effect is short-lived, about 50% success rate. How about return to work? Well, if the patient is out of work for 6 months, 50% return to work. If they're out of work for 1 year, 20% return to work. If they're out of work for more than 2 years, almost none return to work. The best treatment for acute low back pain is to continue with the ordinary daily activities within the limits permitted by the pain. So it seems that the best treatment for low back pain patient is to go to work. All my videos and this video is for educational purposes only. Please consult your doctor before you make any decision about your medical care.